are going to discuss about the trend in diets, what you should know as a medical practitioner. So we're trying to cover why we diet because of health concerns, primarily because of obesity and other health concerns. So, but I will just discuss about the burden of obesity, then the principles of dieting, why we should do dieting, then benefits of weight reduction by diets, and most importantly, popular diets among us and their benefits and concerns, and about the few queries most of the patients frequently ask from us. So we'll try to cover these few factors within this short period of time. So let me tell you that we don't consider obesity as a disease, but according to several international organizations and associations, it is considered as a disease because there's ongoing inflammation which affects all the metabolic functions and biochemical functions in our body, which will lead to psychosocial and health consequences. So obesity is not a risk factor now, it is considered as a disease. So it's a with the multiple factors, and it needs patient-centered individual approach for the management of obesity. This is really important because we can't give one package for all. It does not work for patients. So it should be patient-oriented, individualized nutrition management plans for obesity. So, but remember, obesity is a disease which we have to treat and which can be cured without any medications if you can modify your diet or lifestyle. I don't know whether you can see. These are the recent data in Sri Lanka showing that adolescent obesity and overweight. First chart is regarding the overweight and adolescents. It is which shows a really sharp rising trend towards from 2000 to 2020 from 2%, or at least less than 2%. There's a rise up to 6% during this 20 years. So it is rising continuously. So we have to address this fact. This is regarding the adult. Again, compared to the male, females are obese, but still male obesity and female obesity both are prevalent, both are in rising trend. And just to recollect your knowledge, I know all of you know these factors. BMI. So when we were medical student, it says normal BMI is 18.5 to 24.9, overweight 25 to 29.9, and obese more than 30. But for Asians, we consider 18.5 to 22.9 as normal, because when we consider Asians and other Europeans, we have more fat mass than the fat-free mass. So same when we compare two people from European country and from Asian country with the same BMI, we have more fat, which leads to chronic inflammation and all the complications of metabolic syndrome and other NCDs. So what we should target is to maintain our BMI at least within 18.5 to 22.9. This can differ with the athletics or other sports person, but for a normal person, if we can maintain the BMI within 18.5 to 22.9, it's the best. Otherwise, we have seen a lot of patients who are having all the NCDs without normal BMI, with normal BMI, which is between 18.5 to 24.9. So just remember, BMI cutoff should be lower, because in our country, we don't take this value as a national norm. Why? We take this as a national norm, our obesity percentages will be far more higher, which we can't cater for our facilities. So that is why they don't take this cutoff. So endocrine society, their values are even strict, so we are not adhering to that. But to maintain the ideal body weight, just consider BMI less than 3 is the normal one. And then abdominal obesity, again, waist circumference for men, it is abnormal if it is more than 90, and it is abnormal for female if it is more than 80. So even with normal BMI, if you have waist circumference more than that, it says that again you are having abdominal adiposity, which can lead to all the other complications. So why dieting is important? These factors all you have learned from your medical college. So we know that for all the things we need balance. So here, energy intake and output of energy, it should be a balance to maintain the normal weight. But when we consider the parts which we can control, energy intake is 100% under our control. But when we consider about the energy we are activities we are doing, we can't control resting metabolic rate, thermic effects of foods. Only 15 to 30% of daily activities, this part only we can control. So that is why most of the time we tell that most of the patients, and sometimes we tell that we are doing exercises, we are going to gym, we are doing all the exercises, but we can't lose weight. The reason we are only controlling that 50 to 30% of physical activities, but we are not controlling the diet part. So if we are going to do, if you need to lose weight, both should be there. Dietary control is a must. Then exercise, we do need to do exercise, but exercise will help to lose the weight and maintain the other metabolic activities and optimum lipid profile. But still, for the weight loss, diet will play the mainstay. Okay. So this is just a simple comparison of exercise and diet. So when we do cardio exercises, normally we advise to do 20 to 40 minutes brisk walk, which will burn only 100 calories. And if we run, we have to run 10 minutes with this speed to burn 100 calories. If you are doing treadmill, you may know that if after doing 20 minutes of treadmill only, we are burning 130, 140 calories. And then swimming 15 minutes, cycling 15 minutes. If we are doing all those things, we will burn only 100 calories, which is equal to your 1 bottle of soft drink, 2 chocolate biscuits. You know that 1 chocolate biscuit is having 55 kilocalories. So 2 chocolate biscuits. After exercising, if you are eating 2-3 chocolate biscuits, yes, what you have burned, you have easily gained. And Chinese roll, more than 100, 150. And half piece of icing cake, again, more than 100 calories. So that is why we can't lose weight along with the exercise. That is why diet is important. And so why weight loss is important for patients? There are proven benefits, mortality benefits and morbidity benefits. So 20 to 25% fall in total mortality if you lose 10 to 15% of weight in overweight or obese patients. So diabetes-related deaths, obesity-related cancer deaths, all there is effect from this 10 to 15% weight loss. And for the diabetes, yes, we have already seen in our clinics, if they lose weight, fasting blood sugar improves, HbA1c improves, and lipid profile will improve. So most of them will get improved with more than 10% of fall or rise. So normally when you know that obese and overweight patients, they may have 30 to 40 kilos more than their ideal weight. But our target is normally at least to lose 10% of weight within 3 to 6 months. But we can have rapid weight losses, fast weight losses. I'll discuss it with next few slides. But whatever the target you are having, there is no difference in the weight gain after 9 months. So key point in dieting is weight maintenance. That is the most important thing. Whatever the diet you are using to lose weight, it will help to lose weight. But the difficult part is maintaining that weight, because if you don't change your dietary habits, or if you don't modify your diet or physical activities or lifestyle, again we are going back to our normal routine diet, which will lead to weight gain after losing weight. I'll talk about it. It also causes the losing of muscles and accumulation of more fat. So, and for weight maintenance, along with the diet, exercise play a key role. So, to maintain weight, you have to maintain your metabolic rate. So, along with exercise, it will increase the basal metabolic rate and will help to maintain the weight. So, diets. There are so many diets. I know that with the social media and the other media and so many people, they are giving us so many diets. So the problem is all these diets will help to lose weight, but we are having concerns whether this losing of weight is healthy or unhealthy. Sometimes with this weight loss, we will we will not take our micronutrient requirements, and we will lose more muscles, and there can be health issues. But the main concern is sustainability issues, because these diets, they give for a short period of time, and we are practicing during this short period of time. After this short period of time, what we do is we are going back to our normal routine dietary pattern, which will cause again weight regain, which is not good for us. So when we consider diets, there are low calorie diets and low carb diets, but all low calorie means we are reducing our calorie intake, and low carb means we are reducing our carb intake. And then there are so many different diets: intermittent fasting, vegetarian diets, and General Motors diet. You may have this detox diets. All these diets are used to lose weight. So low calorie, most of the time it is low fat diet. What we do here is we cut down the calorie in our diet. So most of the time calorie cut down will be done using a plate model. So we are cutting down carb and fat mainly, and we increase the protein intake. So just this is the plate model which we have used for several years. So what we introduce is quarter plate of rice, half plate of greens. Greens means whatever the green vegetables, salads, malung, all the things, and quarter plate of protein source. So this is the plate model we are using, which is really effective. So with greens, we increase the fibers, and so here I have put white rice and again then a red rice. So when we consider the plate model, amount matters. We'll discuss about the rice types later. So here we reduce carb, fat, and oil. And there is evidence showing that plate model is very effective in weight reduction in post-MI patients, but not only in post-MI patients, for all the patients who are having fatty liver and obesity and all the complications, plate model is effective. And this is the first this is the diet we use most of the time. So low calorie diet, because it is very simple, easy to advise and easy to do. There are Mediterranean diets. Again, they reduce the calories, but their mainstay of oil is olive oil, and they reduce the intake of red meat and other processed foods, and again increase the intake of vegetable and fruits, green vegetables and fruits, and then non-refined cereals. And they have, as this is a diet from Mediterranean countries, they have advised taking red wine with the one serving per day. So this again had shown that it is effective in chronic diseases, basically NCDs, but it is that low-calorie diet we are practicing is a somewhat deviation from this Mediterranean diet. And this is very low-calorie diet. In low-calorie diet, we advise to give 1,200 kilocalories per, at least 1,200 to 1,500 kilocalories with adequate protein depending on the patient's weight and patient's other clinical conditions. If they have renal diseases, we have to reduce protein intake just like that. VLCD is the diet when we are giving calorie intake less than 800. So normally it is said that we have to add meal replacement with this VLCD diet, but even without meal replacement, we can practice VLCD diet with our normal food intake. With that, we can achieve the rapid weight loss. That means we can achieve this 10% weight loss within 6 to 8 weeks. So it is very fast, and there are multiple positive metabolic effects with VLCD diet. So yeah, by giving 1 cup of rice for 3 main meals with that plate model, basically we are achieving this 800 calories diet, which is very successful in normal patients. But there are concerns. They are having fatigability, sometimes constipation. With this rapid weight loss, there's a risk of getting gallstones, kidney stones, and if they are taking more protein, it can lead to gout flares, and most of the time insufficient mineral and vitamin intake. So we have to monitor them and give unnecessary micronutrient supplementation when we are going for very low calorie diet. But this can be done in our normal routine setup even without meal replacement. And then most popular part, low carb diet, or what you call is Atkins or keto diet. So here what we are doing is we are reducing carb intake and we are not increasing fat, but we are taking normal fat and reducing carb intake. So there are 4 phases: induction phase, and then ongoing weight loss, pre-maintenance and maintenance phase. So what we do is during induction phase, we reduce the carb intake to 20 grams. That means very small amount. 15 grams is half a cup of rice. So just like that. So this 20 grams is also not from rice, from starch and other leafy vegetables. So if we take non-starchy vegetables 1 cup, it will give 15 grams of carb. Only that is taken in this induction phase, and then adequate protein according to the patient's weight and clinical conditions, then higher proportion of dietary fat. So this is the induction phase for a low carb diet. So we are inducing weight loss during this period. So basically no carb intake, which is really difficult for our patients. There are patients who are dedicated to this, who can do it, but in our setup, in this area, most of the time they are living on rice. So advising not to take rice is a torture for them. So that is why we don't practice low carb diet most of the time. But if the patients are willing, yes, sometimes we practice, but it is for a short period of time. Then ongoing weight loss period, again, wider variety of vegetables, seeds, nuts, and low glycemic fruits. That means berries. In Sri Lanka, we can use Veralone, LD, just like naran, just like those fruits, not banana or mango. All those fruits are having high glycemic index, so we can't use those fruits. Then pre-maintenance phase means then with that we can achieve our weight loss goal. If it is 10%, after this 10% weight loss goal achieved, we can slowly increase the carb intake up to 60 to 90 grams of carb per day. 60 to 90 grams mean roughly if we take 2 cups of rice per day, 2 to 3 cups of rice per day. But again, with that increased fat intake, we don't have to cut down fat. But again, this is with the this is after achieving the weight loss goal. So first we have to achieve weight loss goal without any carb. Again, then we can slowly increase the carb intake only up to 3 cups of rice per day. And all phases should have saturated, monosaturated, and polyunsaturated fatty acids. What are those saturated, polyunsaturated, monounsaturated, and polyunsaturated fats? Saturated means obviously what we can take is coconut and coconut oil. Then poly and monounsaturated fat we can take from seeds like peanut, cashew, cotamba, almond. Then omega-3 from small fish, thalia, sudea, salmon fish. All those fish have lot of omega-3 fat. So these food should be in our diet if we are going for low carb, high fat diet. So, and this again, not for low carb diet also, but also for low fat diet, we should avoid processed and refined foods, foods with high glycemic index, and foods with trans fatty acids. So foods with high glycemic index means any food which has simple carb. Again, from raw rice. Raw rice means kakulu. Then palm, bunnies, everything has high glycemic index. Then from fruits, banana, mango, all these fruits have high glycemic index. Then foods rich in trans fats. What are these trans fats? Trans fats are the fats which can change your lipid profile to the total other way around. So where we can find trans fats? Yes, normally what we know is animal what? Red meat. Yes, red meat have trans fat. Other than that, all the bakery products which have brown crust have trans fat. And then anything which is fried with palm oil will have trans fat, because we are using this palm oil to several times, so there will be which lead to production of trans fat, because any oil which has unsaturated fat, if we use to fry or fry, it will go beyond the boiling point and it will produce trans fat. So anything, most of the time, any street food which is deep fried will have trans fat. So we have to avoid these foods even in a low carb diet. And not in the maintenance phase, we can take cereals, breads, grains, and dairy products. But in other phases, we can't take anything. So if we are going for an Atkins diet or keto diet, we have to limit all the carb and processed foods, which is really difficult for our patients. Even for us, sometimes it's not easy. So, but people who are dedicated, who are motivated, they can do it. But again, after low carb diet, the main problem is maintenance. We can do it for 3-4 months. Then yes, we achieve this weight goal. Then we go for the weight maintenance stage, which they recommend only 60 to 90 grams of carbo, 3 cups of rice per day. Again, we lose it after losing the weight, this maintenance is really difficult because it's not modification of our diet habits, not lifestyle modification. So we can't continue it. So this again the same. Keto diet first started, we all know that it's first started for the new refractory seizures in children, which is still using, and where we can see the improvements also. So again, here we can't see any carb here. All things are 1/3 of protein, then grains, then seeds, nuts, and fat. So what is happening in low carb diet? Why it is so fascinating, so fast in weight loss? Because it will induce ketosis. With the ketosis, we use ketone bodies for energy and fat will be hydrolyzed. So what are the benefits of low carb diet? It is neuroprotective. We all know that for neurological diseases, we are using this diet. So it is neuroprotective. And weight loss is quicker and more compared to the low fat diet. It improves the glycemia. In diabetic patients, glycemic control will be improved quickly, and it will reduce triglyceride and improve the inflammation. There are concerns. Even in children, when we start keto diet, we have concerns in increasing LDL and total cholesterol. And when we are taking more fat, it can cause short-term nausea and lethargy. And hypercalcemia, we have seen renal stones developing in patients who are doing this keto diet. And hypovitaminemisis, especially vitamin D deficiency, is common among these patients who have lost weight quickly. Apart from that, there's a high risk for gallstones also. So when we compare low-fat diet with low-carb diet, both have their own good effects. So low-fat diets moderate success compared to a low-carb diet in glycemic control, and very low-fat diet can improve the lipid profile and metabolic profile. Both have good effects in metabolic profile. The problem is with low carb diet is sustainability issues again, which I already told. If we go for low fat diet, slowly we can practice it throughout our lifestyle. But with low carb diet, long-term practice has issues, and when we go through the evidences, they have shown the effects, positive effects for a shorter period of time. We don't have evidence to show this is not good or bad when we do it for a longer period of time, more than 3 to 4 months. That's the other concern. So, and then along with that, we talk about intermittent fasting. What do you think about intermittent fasting? So it is more about scheduled eating, various types, 16 to 8, 14 to 10. Normally, but we can start with 12, because if we think about yourself, we eat more than 12 hours per day. We are starting from 6, we are eating until 10. So it's more than 12 hours. So if we are doing intermittent fasting, first start at 12, at least try to maintain fasting for 12 hours. So it will induce lipolysis, and they say no long-term trials, but this is the recent article I could found from Lancet in April article, which showed that CER means continuous energy restriction diets. When compared to a continuous energy restriction, if you do intermittent fasting, it may decrease weight circumference, which is good for us, which reduce the abdominal obesity, and it will reduce fat mass, it will reduce total cholesterol, triglyceride and LDL, and systolic blood pressure and insulin. So it has good effects. And then this intermittent fasting can increase the HDL and fat-free mass, which is muscle mass. So we can't ignore intermittent fasting. We all know, as I think majority are Buddhists, so we all know that Jayasekara also followed this method. So it is not bad, it is good. So at least try to maintain that 12-12, because more than 12 hours we are eating. We are starting from 6 with the cup of tea, and again at the night, again with a cup of tea, 10 or 12, 11 we stop eating. So this should be changed, not only for weight loss or obesity patients or overweight patients. Even for normal patients, this will improve their cholesterol, lipid profile and glycemic control, and the other metabolic effects will be increased. So basically, when I practice, I normally use low calorie diet and very low calorie diet with intermittent fasting, which is fairly acceptable for the patients in our area, and if they are motivated, they can gain the effects. But I never refuse this low carb diet also, but for a short period of time. If the patient or if anyone is willing, they can do this for a short period of time. For the weight maintenance, they may have to go for low calorie diet. Then there are most of the patients who use social media, they can find this General Motors diets. They are there for a very rapid weight loss. Normally within a week, they can lose 6 to 8 kilograms. They are giving 7-day diet plan. So one day all fruits except banana, just like that. They are giving diets for 7 days. What you have to do is follow this diet plan. At the end of the week, they will lose 6 to 8 kilos. Okay, but again, we can't continue this. And when we are losing weight here, as we are not taking adequate protein, we are losing both fat and muscles, which is not healthy. The other thing is, sometimes, other micronutrients will be lacked there, and dehydration. Sometimes they can cause dehydration because they are giving plants. I first told that we can't give a same plan for all, but this is the same plan for all. Sometimes they may need more water, more nutrients, more calories, so it can cause dehydration. Yes, with the muscle loss, muscle weakness. And there is no scientific evidence to tell that General Motors diets are effective in long-term weight loss management, or obesity management, or NCD management. But yes, if you need a rapid weight loss, we can go for that. But after that, maintenance is your responsibility. Then there are detox diets, detoxification. So they are telling that they will remove toxin from the body and promote health and aid in weight loss. So what they do is fasting for 1 to 3 days, then detoxifying juices. There are several plants given. They are using lemon, oranges, lime, several fruits to as fresh fruit drinks to detoxify body, and they are giving specific fluids, liquids, and herbs. So again, they can lose weight. Yes, obviously with all these diets we can lose weight. There's no argument. But again, no long-term benefit. Weight regain is the main concern, and we lose our muscles. And meal replacements. So what do you think about meal replacement? Yes, they have adequate, that meal replacements are given for specific diet plans. Basically, most of the time in very low calorie diet plans, we can give meal replacement. When we do diets, we give a priority for protein intake. So we have to give adequate protein to maintain muscles while losing fat. So these meal replacements have adequate protein, and they have adequate micronutrients. That means vitamins and minerals. And filling effect is there, but the main concern is they are very expensive. And sometimes, without proper follow-up, if we take meal replacements, sometimes what they do is they take dinner, and for weight loss, they take meal replacement. But we should understand that these meal replacement supplements also have some amount of calories. Normally, 200 odd calories are there. So, if we are taking meal replacement, that is to replace a meal, not an additional drink. And sometimes when they can't, I just heard this story yesterday. One of our doctors who's doing this VSCD diet was with meal replacement, where he couldn't get the filling effect with one meal replacement sachet. So what he did is he took 2 meal replacement sachets per day, per meal. That means roughly 500 calories per one meal. So we can't do that. Even with meal replacement, we have to have a limit. We can take only one sachet for one meal, which can replace our diet. So meal replacement, we have to, if you are rich enough to have money to spend, but you can do it, but it is only for replacement of one meal. Normally, what we advise is use a meal replacement for the diet. You are taking more calories. If you are taking a heavy dinner, replace the dinner with meal replacement. If you are taking a heavy lunch, replace the lunch with the meal replacement. Then only you can get the benefits. Then medications. Yes, unfortunately, there are no medications for weight loss, but we can use these lipase inhibitors, orlistat, as a supportive measures. We can't reduce weight alone with this orlistat. So with the dietary control, if you can't control the fat intake, adding lipase inhibitor will help in weight loss. But you should have a diet plan. You should have a proper dietary restriction of carb intake. With lipase inhibitors, we can reduce some amount of fat intake, which will help in weight loss. And yes, it is effective with proper nutrition management only. And other herbal remedies, there are several herbal remedies which people use, garcinia and so many things. Yes, they may have effects, but unfortunately, we don't have scientific evidence. And with people use laxatives for weight loss. No effect with laxatives. Sometimes they will end up with dehydration and even with AKIs if we use laxatives for a long term of period. Then these are some controversial points we are talking about the coconut. So coconut has saturated fat. If we take a lot of coconuts and coconut oil, it will increase LDL and as well as some amount of HDL. So, but we don't promote coconut intake. Yes, if you are following a low carb diet, yes, you can eat some amount of coconut. You can add some amount of coconut oil for the diet. But for a normal population, we don't promote fat and oil intake or coconut and coconut oil intake, because in this area, people have plenty of coconuts. So they are using huge amount of coconut and coconut oil for cooking, which will lead to obesity as well as grade 1, 2, 3 fatty liver. So we personally don't promote coconut. So healthy coconut intake is okay. That means 5 healthy people can take 1 coconut per day for 3 main meals. That's only. So it is for 5 healthy individuals. And coconut oil normally for these 5, if there are 5 people in a family, we can go up to maximum half a bottle of coconut per week. Maximum, normally what we promote in weight loss is quarter bottle of coconut per week. If you follow, it will have effects. So the most people ask that, Sambola Hundai name. That's one main question they are asking because of the media. When we promote these some methods, they have that high fat diets where they use coconut. But in our population, if we say that coconut is good, they are eating coconut sambal or some any other coconut with this pile of rice. That is what they are doing. Normally, when we say that coconut is good, yes, it is good when we are going for low carb diet. If it is normal diet, we can't have that much of coconut because we are eating carb. We are eating adequate carbs, so we can't increase the sambal or coconut intake. So remember, for a healthy diet, we don't promote excessive intake of any fat or oil. Yes, we can have it with a limited amount. And this is another thing, rice variety. So this is a research done in 2019 which shows that this is glucose concentration or glycemic response. So glycemic response is high with white basmati, then red raw. Raw means capullo. So even anything parboiled will have low glycemic response. That means hamba puhal will have low glycemic response. Anything capullo will have higher glycemic response. So this is very important. Sometimes our people take ratu capullo. Ratu capullo means just after refining, they are having that pinkish white rice, which is capullo, which can increase this glycemic response, which is not good in metabolic equilibrium. So just remember, parboiled nadu is the best. If it is red, it will be better. But if it is white, it is okay, but you can't polish the rice. We have to have that purut in the rice. So parboiled rice is the best for any person. So even basmati, if it is raw, it has the high glycemic concentration or high glycemic response. Then about flour. When we talk about flour, white wheat flour and atta flour, again, glycemic index is, there's no big difference. Carb intake also, again, there's no big difference. Fiber intake, yes, atta piti has large number of amount of fiber, which can improve the satiety. If we eat atta roti, it is not that tasty and it has fiber, so we can't eat a lot. So all those things, this will reduce the amount. When we talk about the nadu rice, also same. Parboiled nadu, we can't eat a lot. So when we compare the capullo and nadu, we are given capullo pingana and nadu pingana, we can't eat the same amount of nadu compared to the capullo. That is what is important, the portion control. So for the portion control of rice, parboiled nadu is the best. Again, if we are taking anything flour, atta piti will be the best because it will reduce the intake. And again, plate model. This will support the plate model. You can see this glycemic indices, glycemic load, which is in the last row. It shows that red raw rice with kiri hodi or just a hodi will have glycemic load of 40. Again, with mixed meals, kottakola, dal, egg, kiri hodi, it will reduce up to 16. This is really important. And white raw with sambal, again 40 glycemic load. But red raw rice, again all these things, white raw 15. So this plate model is really important to maintain the glycemic load. So any rice with greens, proteins will reduce the glycemic load. So that is why plate model is really important for glycemic control as well as portion control. Basmati, all the things will have higher glycemic load with sambal and kirihoti. So if you are taking sambal with this bath, if we think it's good, it's not that good because it will increase the glycemic load. Again, this was done in 2019. Okay. And this again, Kurakan. So Kurakan, what do you think? All the patients think that Kurakan is the best for CNA. And they are taking Kurakan Talapa, Kurakan Kanda, Kurakan Roti. All the things again, if we go back, will not have any mixed meals. It's only flour and coconut, which will increase the glycemic load. So please tell people Kurakan is not the best option for glycemic control. Again, when we look at the glycemic index, again, there's no such difference. Kurakan is better if we can take as a whole, not as flour. Flour, whether it is Kurakan, whether it's wheat flour, whether it is rice flour, there's no such difference because we are taking it as simple carb. We don't, when we are eating string hoppers, we don't add any mallunno. We are taking it with kirihoti and sambal, which increase the glycemic load and glucose absorption. So whatever carb you are taking, if you can follow up that plate model, it will help in controlling the weight as well as glycemic control and other metabolic parameters. And again, kesel or banana. Same, all the types will have the same amount of calories in 1 gram. But we know that ambul is a small one. So it will have low calories. When take anamalu or embu, there are more grams of banana which will have more calories. So banana is not the only fruit we have, and it is it has simple carb. So 1 gram will have 0.9 kilocalories. Simple sugar. So if you take banana, we have to reduce the amount. That's the message. And this is the most important thing regarding on and off dieting. I told you that when you lose weight, you lose lean body mass as well as fat both. But when you gain weight, we gain minimum of muscles with lot of fat. So if you are doing on and off dieting, you will gain more fat and you will lose more muscles. When you lose, muscle and fat both will be lost. When you gain, you will gain only fat. So at the end of the day, what will happen to the lean body mass? Lean body mass will go down with the same weight and fat percentage will go up. That is what is happening with on and off dieting. It is not good. So sustainable weight is really important. Otherwise, what we do is with this detox diet or low carb diet, within 3 months we lose weight. Then we eat for 1 year. Then again we take 3 months and we lose weight. At the end of the day, if you do the body composition analysis, you will have more fat even though you have normal BMI. So sustainable weight maintenance is really important. Otherwise, even with normal BMI, you will get all the complications of NCDs. So frequent diet without exercise is not good. We have to maintain weight. And regarding eggs, so 1 or 2 eggs per day, it says that recent trials, there's no association with cardiovascular deaths. So you can advise, if they ask, we can tell yes, you can eat 1 or 2 eggs per day. And regarding water, there's no effect or benefit in weight loss, but individual effects will be there with the filling effects and everything. But with scientific evidence, we can't find evidence to say that water will help to reduce weight, because so many patients ask whether if we take hot water, whether it will burn the fat. So there's no such evidence. I didn't say not to eat. Yes, you can eat whatever you like, but we have to maintain the portion. Portion control is the most important one. So reducing daily calorie intake is the most important factor for weight loss. You can use any method to reduce the calorie intake, but it should be sustainable. So maintenance of a low calorie intake should be continued throughout the individual's lifespan. There's no minimum hours, but if you want to practice, you can start with 12 hours. Yeah. But I know with 16-8 fasting, 16 to 8 hours, 16 hours fasting also, people will not get any GORD symptoms. If they manage that 8 hours properly, they won't get any symptoms of gastroesophageal reflux disease. But I prefer 14 hours. But we have to start with 12 to 12 hours because we are 16 hours and fasting 8 hours. And so the best diet for weight management is one that can be maintained for a long term. It will be different for person to person. So best diet will be one that can be maintained throughout the life. So some people, it will be low carb. Sometimes some people, it will be intermittent fasting with that 8 hours. So you have to choose what you can do. And you have to continue it. That is the key message. So, any questions? Yeah. Very rapid.
Madam, we are the new nutrition, MSc nutrition. We are actually joining as a group. With the question we have is the percentage or the amount of oil, coconut oil, to be used by a family. Like if a family is having 5
fasting, but for obese patient, weight loss will reduce the risk of malignancies. And intermittent fasting, surely that insulin resistance will be reduced. It will increase the insulin sensitivity, and all the metabolic effects will be. I prefer both together. 12 hours, then low carb diet.
So we can listen to
intermittent fasting, if you are taking 3,000 calories within that 8 hours, there's no point of doing intermittent fasting. That means within that period of eating, you can't eat everything you want. Okay? So, yes. Yes, for we tend to think that vitamin D is given from sun and we are getting all the vitamin D. But if you want to take vitamin D from sun, you have to stay for at least 45 minutes from 11 to 12 in the not that morning sun. So which is not happening, and we are wearing all the clothes. So and we have more melanin, so absorption is very poor. So yes, I think I offer supplementation. Most of the time, if you have that aches and pains and all the things, if you take vitamin D, it will improve. Yes. High dose, single dose means that 200,000 or 3. Yeah. In a deficient patients, no. to 200 or 300,000 3 monthly. Single dose, it should be given 3 months if in a deficient patient. But if we don't have any gut problems, oral is better. But it should be in a deficient patient, it should be at least 3,000 to 5,000 daily, at least for 6 to 8 weeks. But when we consider about the financial effects and everything, I prefer going for that weekly 60 or 50,000 vitamin D for 6 to 8 weeks in deficient patients. But if you take it as supplementation, we prefer giving 2,000 international units of vitamin D daily. Metformin, there are ongoing research for adolescents and patients who are having metabolic syndrome, whether there's an effect, but I don't know about the temperament. Yes. People prescribe, and there are ongoing research. I don't know the effects, but again, with metformin, loss of appetite would be the main reason for prescribing metformin. But we can't prescribe metformin for long term for weight loss, no? Yes. Treatment. Yes. No. Yes. I think it's different, so maybe yes. Yes, one tablespoon per day per person. Normally, what we recommend is clinics. What we tell is to take a quart of bottle per week. Sometimes, when we consider about our patients, they are taking three bottles per week. So they can't reduce up to quarter bottle. So we tend to ask at least to take half a bottle. So quarter bottle per week. Yeah, each person.
Yeah, certainly. So it's very interesting that when it comes to nutrition, we get a lot of calculations coming up.
Yeah.
So just tell us, somebody, what is our usual energy requirement per day, like per person, just to maintain routine daily activities?
Considering we are sedentary.
Yes. So.
Yes. So gain per kg. 15 to 20 kilocalories per kg is enough.
70 kilos per person require.
Yes, 1,400. That means 1,400 to 1,600 kilocalories.
What is our Sri Lankan based diet?
Yeah.
What is the usual energy that is included in that diet?
Normal diet. Normally, if we are taking this 1,600 calories, yeah, you are maintaining weight, but normally it's more than 2,000.
That means there are about 500, 600 excess.
Yes.
So that is going to be deposited as fat.
Yes.
Simple as that. So when we are.
Yes. And especially. Yes, especially childhood obesity will be a big problem in the future. We are having a lot of children referred from school having diabetes, grade 2 fatty liver, and dyslipidemia. We are having a lot of kids who are referred for obesity. Almost all are having dyslipidemia and fatty liver.
So even if you skip a single diet, one diet per day, still you will not. You can balance the input and output, but if you have to burn the excess, then you have to go further down.
Yes.
Simple as that.
Yes. You have to cut down at least 500 kilocalories per day.
Or else you have to engage in activities.
Yes. 2 rolls, 1 cup of tea is 500.
Not that easy, isn't it? So
no, it's
human
not.
body is a very efficient machine, I would say. If thing did not happen, we would have ended up with a lot of hunger. So
We are born.
whatever the thing that comes to your stomach will be absorbed and taken as energy. So it's continuous.
Because we are survivors.
It's not that easy to come to this healthy diet without having good commitment towards it.
Yes. If you committed for near at least 3 months, then it will become your habit. And yes, people can have tea or coffee without sugar, even though we can't have, because that's their habit. So we have to change our habits. That's so simple as that, changing habits.